Champ Plan is an incredibly unique approach to employee engagement, health and well-being, and using the tax advantages that are available for every employer in the United States.
Champ is an opportunity to have a set of benefits, supplemental benefits that sit in front of your current major. Maybe you got Blue Cross. Now you've got an opportunity to have something in addition to that. What does it do for the employee? No out-of-pocket when you go see your primary doctor, your urgent care. But it's also an opportunity to have free medications, over about 300, not only for the employee, but for their dependents.
The employer gets to participate in some tax savings and any surplus that's left over at the end of the year. So, they're playing the role of the insurance company because it's a self-funded plan. But it's really genius structuring to where companies are rewarded for doing a good thing.
From a high-level standpoint, it's a tax advantage health management plan. That's the technical term. If you look at 4 overlapping circles, you've got some tax advantage opportunities to save as the employee and as the employer. The other circle is you've got some skinny benefits that act as a speed bump in front of your major medical, but it also helps the employee address out-of-pocket expenses. The third circle is the telemedicine, but telemedicine on steroids. There's an opportunity to have a touch point with a medical professional, but there's an empathic portion where if you, as the employee, you've got questions about a bill, it's confusing, maybe there's some charges you don't understand. Maybe you want to shop a procedure and get the best price, so your out-of-pocket is minimized and the expenses hitting the major medical are reduced as well.
At the end of the day, it's structured in a way where there's no out-of-pocket cost to the employer and no out-of-pocket cost to the employee.
And then there's an opportunity, and that's kind of the foundational offering, to have health and wellness content sent to an entire workforce. And the whole idea is to bring a workforce that had a higher risk, less well, and move them toward a lower risk, or they have more wellness, and that also impacts your major medical. So, and I use my sister as an example. She was divorced, 2 kids, 42, probably couldn't afford the Cadillac plan. It's an opportunity for her to be able to have these additional benefits, not have $50, $100 coming out of her pocket. And as a single mom, that's impactful. So, when I heard about the plan, it just resonated with me as a former clinician, an opportunity to help the Robins of the world, but also to bring a workforce and be able to address the chronic disease issues and the wellness issues that are so important these days.
I think everybody knows that's the way it should be, but everybody knows that's not the way it is, right? Just offering major medical is extremely expensive, and it's regulated dramatically. So the Champ plan has been able to do what should be done, I think, just generally speaking.
It's a wonderful combination to drive a far greater value, not only for the employer, but especially for the employee and their family.